The presentation is really focused on two parts. The first part talking about frontline therapy as the first choice for patients with Hodgkin lymphoma, and then the second talk talking about patients who progress after getting frontline therapy and looking at outcomes for those patients. Dr. David Strauss did the first presentation talking about frontline first choice therapies, did a really nice job of discussing kind of the role of combination therapies, but the role potentially of giving treatment without radiation therapy compared to adding radiation therapy in a combined modality approach, and then talking in advanced stage patients with the use of combination therapies, again now incorporating some of the newer drugs including Brentuximab, Vedotin as frontline treatment. In the relapse setting was the area that I was discussing, and I really tried to highlight three kind of things that I think are becoming exciting and novel and new in Hodgkin lymphoma. The first is in patients that have relapsed, their first salvage treatment. There have been a number of trials now utilizing all of the new drugs, and this is Brentuximab Vedotin in combination with a PD-1 blocking antibody. And the studies really show a very high response rate of 81–82% with a complete response rate of 62%. That looks remarkably similar and possibly even better than some of the combination chemotherapy approaches that have been used in the past. And the advantage of that is less toxicity because these are more targeted agents and well tolerated. So I think these novel combinations as first salvage really look very promising. The second was just to remind people of a little older data, but I think still very important, in patients that have a transplant, but particularly those that have high-risk disease. Those patients can really benefit from using Brentuximab Vedotin as a consolidation approach for a year after undergoing their transplant. And I think that, again, in patients that have early relapses, were refractory to frontline therapy, or progress with disease outside of the lymph nodes, those are really people that benefit a lot from that approach. And then the final thing was just the excitement around PD-1 blockade and the fact that that's a highly effective therapy in patients that have relapsed, patients that also relapsed after a transplant or Brentuximab Vedotin. And again, in those patients, the response rates have remained high as we've got more and more data from confirmatory trials. And I think the interesting thing is that even if you block PD-L1, kind of the other side of the PD-1, PD-L1 axis, you're still seeing high response rates. So I think those agents have become very useful in the way in which we can manage patients with relapsed Hodgkin lymphoma.